This series on women in science, technology, and business is brought to you by Zoho Corporation. Zoho is the operating system for business.
Hello, I'm Kamla, and my guest today is Dr. Rajni Agarwal-Hashmi. She is the Associate Professor of Pediatrics and the Medical Director of Pediatric Stem Cell Transplant Program at Stanford University. So she's a doctor, a researcher, and a teacher, and her focus is on stem cells. Well, welcome to the show.
Thank you, Kamla.
Thank you for coming. You've made time in your busy schedule to come here.
You're welcome. You're welcome.
Let's break down your title. You know, it's a lot. Associate Professor of Pediatrics. What is that? What do you do?
This is my academic title. So at the Stanford University, we are professors and we are teaching in medical school. And so we are given the academic titles, and then you get promotions from these academic titles. So Associate Professor is my academic title.
And then the Medical Director of Pediatric Stem Cell Transplant Program. That is such a big mouthful.
Yes, it is. This second title is my clinical title. It's from the hospital, because we have a stem cell transplant unit in the hospital where all our transplants happen. And I am the medical director of the transplant unit, and therefore all the activities come under me, clinical activities, so to say. And that's where the second title comes from.
So that is research oriented?
That's for clinical and clinical research.
Okay. So you run clinical trials then?
Yes.
Okay. So you are engaged in basic research, in a sense, in a fundamental research.
Yes. I am involved in basic research in a very unique way. I'm not at the bench doing the research in the laboratory. We have physician scientists who work with us. And Stanford is a great place for that, because we have so many smart people doing the work. And then our job as clinicians is to work with them to bring their discoveries in the lab to the bedside.
So that's what you call bench to bed.
That's why we say bench to bedside. And that's the translational medicine that brings about all the novel treatments. And how would a novel treatment come from the bench to bedside? There is the discovery. Then there is the formation of the clinical trials. And clinical trials take many years to complete, because initially you have to evaluate the safety, efficacy. Are they really holding up in the large-scale population studies? So there are many steps of that. And that's when it really becomes possible to treat patients with a novel treatment. So that's our job.
So the hospital is 25 years old, Stanford
Yes.
Hospital.
Yes.
And the stem cell research was founded 25 years ago?
No, actually, there have been scientists who've been working in this area even before then. So
At
we
Stanford.
have, yes, our Weizmann is a very famous scientist who had worked on isolation of these stem cells and finding purified stem cells way before this hospital was made. So this basic science part was there. There was an adult hospital, and pediatrics was a smaller part. And then the Children's Hospital came along, which specifically treated children, and that's how the progress was made.
When did you come to Stanford?
I came to Stanford 16 years ago, 2001.
So almost at the start of probably the lab?
You know, the year I came, they were celebrating their 10th anniversary, hospital was. And the scientists were here long before me.
Okay. So tell us about your work. What is stem cell?
So stem cell is a generic name that is used to describe sort of mother cell. Now, I really want to make it clear, and we should take a little time on this, because stem cells can be there, which are the originators of blood. Stem cells could be originator of the muscle, could be originator of the cardiac muscle, or neuronal cells. So in early embryonic life, these stem cells are there, which are called totipotent stem cells or pluripotential stem cells. These have the ability to differentiate into any of these. You can make cardiac cells. And then slowly, as the development progresses, the stem cells sort of differentiate towards making one thing and not everything, right? We need that. So then they become more. So when we are talking about stem cells in my area, we are talking about stem cells that are produced in the bone marrow. And these are the cells that actually give rise to blood.
Got
all
you.
components of blood.
Okay, so there are different stem cells and your focus is
That's
on
right.
the bone marrow stems.
That's
and
right.
even within that, you are focused on children.
We are focused on children, yes.
Okay, so what is it that stem cell transplants fix or help kids that may have diseases? What kinds of problems do you fix?
Yeah, so it's a very effective way of treating many disorders that actually arise in the bone marrow. So think about it. The bone marrow is making all components of blood, so red cells, white cells, platelets, and the cells that give you immunity, the ability to fight against infections. So if there are so many of the white cell disorders, there are red, all of these can be fixed by bone marrow transplant. And in pediatrics, it is very special because there are a lot of genetic disorders that present in early childhood. Sometimes the babies are born with those, and they have no other treatment to fix these disorders except to perform a bone marrow transplant. That means you're removing the cells that don't function or are not there at all and giving the patients a new system, a fresh start. And so we actually transplant from little babies who could be a few weeks old to 21 years of age.
And they would have some genetic...
They could have some genetic disorders. The other group of patients that get benefited from stem cell transplant is patients who have leukemia, lymphomas, so these are all people who have malignant diseases, cancers, immune deficiencies where patients don't have an immune system, immune deficiencies because they are born. Immune deficiency, like I said, the cells that fight against the immune system are made in the bone marrow. And
so they get corrupted or they get weakened?
They do not get made. There are mutations that the cells that are made don't function. So there are many, many disorders like that. And so the thing would be that if you could effectively remove these cells, remove the bone marrow that's there, which is and put in a new system. So definitely that approach works, and it's a very it's a procedure that has led to many cures in this area, and especially in children. Children are so resilient.
Why are children resilient?
I think, one, they don't have tons of other diseases that the adults. Their metabolic system functions differently. So they metabolize drugs in a more efficient way. They don't have all the other comorbidities, say diabetes and predisposition to heart and all of those things. So they do really well. I mean, it's like sometimes you say, how can you give chemotherapy to a small child, right? But they actually do very well with it.
So you mentioned that stem cell, you replace the damaged cells or the corrupted cells or whatever with new cells. Is there a problem when you're grafting them to removing the old and putting new? Does the host accept those cells, that is the human being?
Yes, of course. So the donor is very important in all this, the person who is donating those cells. And you can take these cells from donors, donor bone marrows. You can take these cells from cord blood. You can take these cells from peripheral blood. I mean, so the donor part is very important. And then when we prepare the patient, we prepare, that's the art and science of transplant, that you prepare the patient dependent upon the disease, dependent upon the donor, and many other things, so that they can accept the graft and keep the graft.
When you say prepare, what do you mean? What do you do in terms of preparing?
Yeah, so preparation of the patient involves two things. One, you make the space, because the bone marrow is, there's this meshwork already there that's making, so we have to make the space. Think about it, solid organ transplants like liver transplant or kidney, where surgeons have the ability to go in, surgically remove the organ and put in a new one. We can't do that. Ours is a non-surgical approach because bone marrow is in so many places in your body. It's in all the long bones, in the flat bones, in the ribs. And so what we have to do is to have a systemic agent that will remove bone marrow from every place. And so we use chemotherapy.
Oh, so chemotherapy is the way to
Chemotherapy is
kill.
the way to kill. And for some leukemia-like disorders, we could use radiation. And that
What is the difference between chemotherapy and radiation?
Well, chemotherapy is chemotherapy agents, which is like given either oral or IV, and radiation, you all know, is administered through the radiation facilities. And we don't want to really use radiation for younger children for development and growth issues. So you have to be very specific for when you use it, how much you use it. So you have to have very specialized radiation oncologists working with you, and then chemotherapy. So these two things make the space. So this is about a week-long prep where you have designed this regimen to make the space. So the bone marrow is on. And then simultaneously give immunosuppressive medication so they don't reject. They don't reject.
So you have to monitor them constantly.
And then one important thing is that when you infuse these stem cells into the patients, you infuse them via into their veins directly. So it's not that they need to have surgery, that I need to go in their bone marrow and inject it back. No, you give them, and you know something very interesting happens. When you infuse the bone marrow cells through the IV tubing, they actually settle down and find a home in bone marrow. The whole process is called homing. And what interesting biology. They're going through all this circulating blood. They don't settle in any other place. They settle in bone marrow because there's specific receptors there. I mean, this is amazing science. And they just settle in the bone marrow and sit there, and then I say, oh, they are setting up shop. They will take a couple weeks to sort of start showing up, and then they proliferate, they divide, and then you start to see the new white cells come up and the new red cells come up, and oh, voila, you know, that's great.
Wow, you look so excited when you talk. I've never seen any doctor get so excited about it. You love it. So for those of us who don't know what the Children's Hospital at Stanford does, and especially your stem transplant program, what is it that you've contributed to fixing problems for kids nationally? You're a nationally recognized institute.
We really are at the forefront for doing transplants for malignant diseases, leukemias. We are at the forefront for developing regimens for patients with genetic disorders. So we focused on doing, there are two genetic disorders that are red cell disorders, the sickle cell disease you must have heard of, or the thalassemia you must have heard of.
I don't know leukemia.
Thalassemia.
Thalassemia, okay.
So there the abnormal red cells are produced, and these children are dependent on blood transfusions, and then they get iron overloaded and whatnot. The quality of life really becomes a problem and all. And when we do the stem cell transplants, quite effective. However, you know, we talked about doing chemotherapy, and it causes a lot of toxicity, and the parents are in a bind. Do I really take my child to the transplant, do this, expose them to this chemo? And then they get sick also, because it's not a risk-free procedure. There are risks to the procedure. So we were really at the forefront developing reduced intensity protocols where chemotherapy was effective but gave little less side effects. But I think now we are entering a very exciting era.
In what way?
Because we have several clinical trials in the pipeline. And again, that's the bench to bedside concept, where the bench part has come from our own university. Our scientists have contributed, where one, we have a trial open right now for immune deficiency patients who had a previous transplant and didn't really make enough of their immune cells.
They didn't set up shop.
They didn't set up enough shop. They did something and we now have opened this trial where they will go through another transplant but without chemotherapy. And there is an antibody that we are going to utilize which will help us empty the stem cell niches. And if this procedure works, that's where transplant should go, because why now
so you're removing
we have
the
to
toxic
do
part.
Absolutely. And I think that this is really bringing a lot of excitement to us. We are really, really happy that the trial is open. FDA has really given us a green light, and we should see next couple of years what it brings, and then I would say sky's the limit. That's one. We are trying to reduce the other complication incidence, which is called graft versus host disease, which is because of the donor and host reaction. Again, quite debilitating condition. Sometimes we have really adverse outcomes because of that, and unacceptable for children. And so we have a scientist who has these specific type of T-regulatory cells. She's in fact our division chief, and she is just spent many, many years working on these cells, and these cells actually induce tolerance. So what we are opening our trial where these cells will be given, these specific T-regulatory cells will be given along with the stem cell graft, and hope that they will induce tolerance and reduce the graft versus host disease. I mean, those are the kind of things. And third would be genome editing.
The CRISPR technology.
The CRISPR-based technology. And again, the science is coming from Stanford, and we are looking at diseases that have point mutations. And you actually, can you believe it? You actually edit the genome and remove the point mutation, fix it with a normal piece of DNA.
So it's precision medicine.
Precision medicine completely, and you give it back to them. So you take their own bone marrow, you correct the defect, put it back. Less side effects, less of everything. I mean, so I really think that next 20 years, totally exciting. And from Stanford's perspective, I think that's the way to go.
What did you think you were going to be when you were young?
Didn't know.
You did not know?
No.
Were you good in studies?
I was good at school, 10th grade. I was good at school. However, my other family members, my cousins, they were also all very good at school. So it's like, okay, everybody's smart, but didn't know what I would be.
You had no idea what you were going to do, were you good in math, were you good in science, what were you good at?
I think math was my less favorite subject. I
think
I was very good in physics, and I thought I would want to study physics. And then, well, the family thought about it and said, is there really a role for a women physicist? You're talking 50 years ago, 40 years ago, that what could you do? And then, the idea was, okay, well, maybe do you want to really switch to humanities? No. And then, my father decided that I should take the pre-medical test, the PMT test. And
why did he decide that you should take PMT?
He said that after looking through all of these other things that are going on, you like biology. At the time, there were not enough women engineers in the country either. And so he said, well, medicine might be better. Well, but don't take too many attempts at PMT. Try to do it in one go. Now I have to say...
That's the entrance exam.
Entrance exam. I have to say that my father wasn't the cookie cutter type father. You have to be this. I remember him telling, we are 4 siblings, and him telling us, you know what, I don't care what you want to be, but whichever that you become, you be the best at it. So one day he's talking to us, and he's telling us, if you want to be a shoemaker, it's fine with me, but you want to be the best shoemaker in town. Nothing other than that. And I think we, all 4 siblings, remember that. I could get emotional about it because that's what we are telling our children.
So the excellence, the focus on excellence.
Excellence rather than what you do. And this is what actually we have ended up teaching our children. And let's see how it pans out. But we have also, learning from that, said, go do what you like, but
be good.
Be very good, not good.
So you're sitting there, you didn't know that you wanted to do medicine, you give the entrance exam. What happens?
Well, I did very well in the entrance exam. And so in the state of Madhya Pradesh, where I went to school.
In India?
In India. There were 30,000 students and 750 to take for the 6 medical schools.
So 30,000 students fighting for 750 seats.
Right. And these 750 seats were distributed in 6 medical schools in MP at the time, Madhya Pradesh at the time. And so I did quite well. And then I
But did you know that you passed the exam?
No.
Because you're a mass of nerves, you mentioned, when the results came out.
The results used to come in the newspaper. And they will have these roll numbers. And my father brings the newspaper, and he's looking, and he can't see. And I'm like, oh my God, and I'm running to the bathroom, and I said, no. Then I finally said, Dad, can I please, let me just see. And I snatched the newspaper from his hand, dying. And then I looked, my name was number 1, and he wasn't looking there. And then he started crying, and he said, do whatever you want to do. I'm not going to ask you.
So what does it tell you about your dad and why he didn't look at that first column?
I honestly think that he knew I was good. No, I know that he knew I was good. He just didn't realize that he thought
that
that 30,000 students, I mean, really. And I think it's being realistic. I don't think that that's, you know, and I think some parents may say, oh, my daughter and my son has to be number one.
But you spent a whole year cooped up studying for the whole summer, studying for the exams. So
he knew I studied, and he knew I had to study. We didn't have much means. I come from a very modest family. You know, so he would have thought there are students who have gone to much better schools, you know, they have gone to all these great schools and they would do better. And him and I and my mom, we learned the lesson that actually school contributes, but not everything.
You have to apply.
You have to apply. You have to work hard. And I think we all learned with that.
Okay. So did you know English when you went into medical school?
No. English I didn't take as a subject in school. I studied in Hindi medium public government schools.
You couldn't read and write English?
I knew my basic, but I didn't know any grammar, no punctuation. And I'll tell you something very interesting. When I went to medical school, this is the first time the textbooks are in English, and I'm trying to write something. And my father that summer gave us the assignment that every day we all will do a paragraph translate in English, because he knew that we were not learning English. So I'm trying to read my textbook and I'm writing. You know, in medical school, you have GI tract. You call it alimentary tract. You spell it at A-L-I. And my father kept correcting, no, it's elementary with E-L-E. And I said, no, Papa, no, this is alimentary. And he said, so...
So you had the phonetics problem.
So we were just thinking, yeah, and I still have it.
Well, but it doesn't show. So how did you then get interested in stem cell?
Well, you know, so medical school, and I went into, after doing medical school, I went into pediatrics, and that was on my mother's suggestion.
Oh.
And she said, I said, the merit list got made. I was a valedictorian in the college and could do whatever. Most girls will go and take obstetrics and gynecology. My mother and I were talking one day, and she said, you know, the lifestyle in obstetrics and gynecology is just too much sometimes, and your family gets affected. You know what, even if it's the middle of the night and somebody's child, they could bring the child to your door.
So your mother was the one who put the idea. She was the one,
and she's really a smart, you know, very practical, smart woman, you know, and so she put that sense, and I did pediatrics, and that's the best decision I could make. And I found I had incredible mentor in general pediatrics. She still lives in Indore, wonderful.
In India?
In India, wonderful. She shaped me in many ways. And then I was looking around because I didn't want to do general pediatrics, and there was nothing available. Cardiology, neonatology, yeah, little bit, and India was just evolving at the time. So one lunch time, working at Safdarjung Hospital in New Delhi as a registrar, which is just basically getting additional training, somebody said, why don't you come to a lunch? It's free. Sure, we went. It's the Indian Academy of Pediatrics local chapter lunch. Okay, I'll go. And there was this man in a wheelchair with very shining eyes. He gave the talk.
Oh, and he was a doctor?
And this is Dr. Suresh Advani, who changed my life.
And he was in a wheelchair? He's
in a wheelchair because he has acquired polio in childhood. He cannot walk. He did everything in that wheelchair, all his training. He's a remarkable man. And the way he gave his talk, and he talked about these 6 patients that they'd done bone marrow transplants in India. You're talking mid-80s. The field was just, you know, new. And I still, till this date, remember the slides that he projected and his voice. It was so impressive to me. And then right after the lecture finished, it was my calling. I went up to him and I said, I really loved your talk. And he looked up at me and he said, thank you. And said, what would it take for me to do what you do?
You said that? Mm-hmm. That's bold, especially in India.
But you have to be, right? I just thought I wanted to do it. In general, at that time, even more so, I wasn't a very outgoing person. I'm a shy person, but I just couldn't resist. I just said to him, I like to do what you do. What would it take? And he said, do you have your CV? I'll send it to you.
CV is your resume.
A resume. And I sent it, and I wrote a letter with that and said, even if he did not pay me, I will fund myself because I'll live in the dorm.
And that's what you ended up doing?
That's what I ended up doing. He paid me some very small sum, which was enough just to eat, 500 rupees a month.
Wow, That's not much.
No, even then it
Yeah,
wasn't.
even then.
And I ended up in Bombay a month later, and that. And the second thing he told me, and this is something very important for anybody to learn, hear, whatever, he gave me the direction. 3 months after working at the Tata Hospital in Bombay, which is the premier cancer hospital, one day he calls me to his office and said, Rajni, if you want to make a difference in the field of transplant or oncology, you cannot just follow the written protocols. You have to innovate. You have to be developing new strategies. You have to be in research. And there is a small research center with Tata Hospital called Cancer Research Institute, CRI. And I went there and I learned.
I only have a minute left, and I quickly want to ask your contribution to stem cell research. Through some quirk of fate, you ended up coming to the US, and you were working in the Children's Hospital in Ohio. And that's where you helped set up the stem cell lab.
Yes, and so my interest in stem cells continued. I got trained in Toronto and then NIH, all of done by
National Institute of Health.
And National Institutes of Health, and Cincinnati Children's actually enabled that. And then I brought all this technology. The cord blood transplant field was just evolving. There was a lot of basic science, but at that point I started to work with a few private companies, but also running a study with the local obstetric units, developing the systems for collection and studies and all that. So yeah, I would say, and we did actually at Cincinnati Children's the initial cord blood transplants there. Now everybody does it.
You know, I wish we had more time to talk about your initial cord plant transplantation, but you really have contributed so much, especially for the health of young kids. Thank you so much for stopping by and talking to us.
Thank you, Kamla. My pleasure. Thank you.
And thank you for watching. If you missed any of our shows, you can watch them on our YouTube channel. We'll be back again next week with another episode. Until then, goodbye.
This series on women in science, technology, and business is brought to you by Zoho Corporation. Zoho offers several applications to run your business.